Afternoon, guys. So for this week, we decided to do things a bit differently. I thought maybe if we try to spice things up, you guys might actually find it quite interesting and try to make these discussions more captivating and stuff. For the first time, I'm the one who's facilitating. To be honest with you, I'm be looking at an area I find interesting. Personally, I enjoy this area. It's on bipolar disorder. So I thought you guys are really going to have a blast. You're going to have, though it's a small discussion with relatively few people than we usually have. I feel, yeah, it's going to be an interesting discussion. Oh, by the way, it's Tanya's birthday, so she went out, so she couldn't join us for this discussion. Happy birthday to her. Yeah, I'm jealous. She could have called me and I could have gone with her. But anyway, it's fine. It's fine. So for this week, we're going to be looking at bipolar disorder, and I hope you guys are going to enjoy this discussion. So stay tuned. My name is Anupam Rambiwa. I'm a volunteer at Creatism, and I co-host these Zoom discussions. Can you hear me clearly?
Yes, we can.
Okay, perfect. So for this week, we're going to be looking at bipolar disorder, which is a very I don't say complicated, but it's a people misunderstand bipolar disorder. It's one of those few mental health issues that people don't really understand that much. So I was hoping that for this week we can deal with that and sort of have it what's the word I'm looking for? Cleared out as to what bipolar really is. So to start off, I think let's just start off with introductions. Can you just introduce yourselves?
I'll go first. My name is Bianca. I just joined Creatism last month.
So move on to our psychologist.
Hey, hi everyone. I'm Nombulelo Kroko. I'm a clinical psychologist.
And lastly, hello, Tina.
Oh, okay. I thought my network was slacking. Hello everyone. My name is Tino Tendangoy. I'm a social work student. I'm in 1-1.
Okay, I think that's about it. That's good. So I think we can just start. Let me just do something over here. So yeah, bipolar disorder. What is bipolar disorder? Do you have any rough idea what bipolar is? What do we think bipolar disorder is? When someone is said to be bipolar, what's really going on? We'll start with Bianca. What do you think being bipolar is?
I don't know much about it, but what I know is when somebody's bipolar, they have episodes of which are called manic, which are episodes of high, and episodes of really low feelings like depression.
Okay. Tino, what do you think being bipolar is? When someone is said to be bipolar, we are bipolar. What's going on?
Well, bipolar disorder is I don't know if it's safe to qualify it as a mental disorder, but I think it's a mental disorder that like the person who's sick engages in a variety of mood swings, a variety of episodes, right? Where, like, for instance, he or she can be happy for like 5 minutes and then can enter into a series of depression for like another certain period of time. So it's just a change of moods basing on the certain individual.
Okay, Mrs. Nomulelo, can you take this question for us? What is bipolar?
Okay, so in layman's terms, I would say we're looking at highs and lows. Where a person is too excited, they're too ecstatic, not really because they got a new pair of shoes or because they've got a new boyfriend, but for no reason. And this can go on for maybe hours or days or weeks. And then the lows, that's the part when they like feel it, when they feel depressed, when that excitement has gone away. Yeah.
Still on that, I came across a misconception that people have when it comes to bipolar disorder, and even myself, I have it. Like, no matter confused as to what's really going on when we're talking about bipolar, and I hear people who talk of schizophrenia and bipolar as if they are interchangeable. Miss Nomulelo, would you please clarify if there is any correlation between someone who is schizophrenic and someone who has bipolar? Is there any relationship there? Or the two interchangeable, two totally different disorders?
Okay. So this is like talking about diabetes and ulcers. Yeah. So there are two different things. What happens is sometimes they are just similar symptoms. Like say, if someone is in the manic episode, they can have psychotic symptoms where they are hearing things that are not there or seeing things that are not there or believing something that is not real, like saying I am God or I'm the president or I'm the president's daughter. So that psychotic part, we can say it's similar. But basically, when you talk about bipolar, it's a mood disorder. It's a mood disturbance, highs and lows, and there's some normalcy in between.
Thank you for clarifying that, because people tend to interchange the two. So sometimes it's easy to assume that it's just one, like it's a term, which two terms which can be used interchangeably. But thank you very much for clarifying that. So
Yeah, yeah.
given that we heard that there are different types of bipolar disorders, do you guys, could you clarify on how these different types of bipolar disorders are and how they work? What really goes on?
Okay, is that for me or for everyone else?
It's
Okay,
for you.
so
I'll
I like.
come to everyone's questions. I'm still on you, ma'am.
Oh, okay. All right. So I like to talk about bipolar 1 and bipolar 2 because they're the most common. Um, so basically, like I said, we've got the highs and the lows. So in bipolar 1, the high is what we call mania. Okay. And then in bipolar 2, the high is what we call hypomania, which is like a mini mania. It's not as serious as the mania that you find in bipolar 1. So the mania that you find in bipolar 1 is the psychotic one, the psychotic symptoms that I just talked about earlier, where a person is they're too excited, they've a high drive, they've lots of energy, um, they've got, they're sexually preoccupied. The world is great, the world is amazing, plus psychotic symptoms. Hypomania, they've got that, but no psychotic symptoms. And then the similar part comes to the depression part, where from excitement, you then get to a point where you feel depressed. You are now feeling low. You're suddenly feeling hopeless. And now you have got all these negative thoughts. Everyone hates me, no one likes me, I'm a bad person, and things like that. Yeah. I don't know if that makes sense.
Yeah, that makes sense. Thank you, ma'am.
Yeah.
Okay, so guys, this was a general question for everyone. Are there any myths that you might know concerning bipolar? Something that you have been told? I'll start off. Like, I think if you have seen the previous videos I have covered, I usually say that mental disorders in our cultures, Shona people, or the Ganzi, Kuroiwa, or Kuping, it's not something that is taken, So from where I come from, if you are sick with bipolar or depression, those rumors where it's witchcraft, sorcery, someone is, which is not true, but that's a myth that really comes with this bipolar. They're making themselves look funny for whatever reason. That's something that actually comes. That's a myth again. So do you know any myths that are associated with bipolar disorder? Bianca?
I think people tend to say someone is bipolar even when they're not. If their mood just changes, they just say, oh, she's bipolar because she's doing this. I think people just throw the words out there when it's not necessary, which kind of brings stigma to the disorder, because people who actually have bipolar disorder may end up not being taken seriously.
Tino? Would you happen to know any myths or some misconception that goes around bipolar?
Both of you just said everything that I want to say, but let me just add on. In our African culture, um, having or being bipolar is considered as some sort of witchcraft, or you were cursed by our ancestors, or or you displeased, or you did not please the ancestors or something. So you get this bipolar item. And also to agree with Bianca on what she said, I feel like the term is just thrown around. Like people don't know what the term means. When a person may have like a mood swing, I don't know that he or she is bipolar, of which we need to thoroughly educate people in order for them to identify a person who's bipolar and a person who's not. Because when you actually need to take a person to a mental hospital, you may not be able to diagnose if a person is bipolar, because we lack that knowledge. So I feel like those are the myths behind being bipolar. I don't know. I don't know. I just feel like that's the item.
Thank you. Mrs. Nombulelo, would you have you would ever have you ever came across any myths concerning bipolar? Have you ever came across any myths that people might have about bipolar disorder?
So, well, with time, I've noticed that people don't know much about psychiatric disorders. So every mental condition is seen as one thing. So as long as someone has got a mental disorder, it's normally attributed to witchcraft. This is why you see families of the person who's being afflicted, they'll first go to a traditional healer before they go to a psychologist, because they think something is wrong in this spiritual realm and it has to be rectified there. When they don't get the answers, that's when they'll look for a psychologist. So yeah, witchcraft.
So the overarching myth is how it's how bipolar, just like any other mental illness, is attributed to witchcraft, basically.
Yeah,
Or lack
yeah,
knowledge. Okay,
yeah.
I thank you very much for that. So
Mm.
how do you then think bipolar disorder impacts an individual, like in an individual's life? Like examples of how it does that socially, at their workplace, even in relationships or to their health. How does how do you think bipolar disorder impacts a person's life? Can we just all reflect on those and give me feedback on what you guys think?
So
Yes,
I'll
Bianca.
take that one. Oh, okay, sorry.
It's okay. It's okay, ma'am. You can take it.
Okay, sorry. So like say if we're talking about relationships, imagine you've got a friend. You have had a good time yesterday and all as well. The next day you're being shouted at. Or the next day the person doesn't want to talk to you. What will happen to that relationship? Or you have just paid lobola or rora for a girl. The next day she says, no, I don't want to be with you. I'm going to get married to Will Smith. So you can imagine what that can do to relationships. Or maybe another simple example would be, we talked about bipolar, a person with bipolar may be having racing thoughts, so they've got a lot to say. They speak non-stop. Say in the workplace and you've got a boss, and each time they talk, you seem to have much more to say than them. What will happen at work? So it does affect um, every facet of that person's life. Yeah,
Okay,
as long
thank
as it's
you.
not controlled. Yeah.
Thank you, ma'am. Guys, would you have something to add there? Something you just think on the slide I just put there, how bipolar disorder might affect a person's life. Bianca.
There's a movie on Amazon Prime which I watched a while back, which really shows the effects of having bipolar disorder, and it just taught me a lot. So this lady had an amazing job. I think at her job, whenever she was in the highs, so she would talk to everybody at work, invite friends over, hang out with friends, and then when she had her lows, she couldn't even get out of her bed. So then she would miss work, and even her boss was threatening to fire her, and her friends would call her and ask, hey, why did you disappear? But she couldn't even pick up a phone. So I thought that was a really good depiction of bipolar disorder. So I think it could affect relationships, like Nombulelo said. Probably like every aspect of your life could be affected.
Okay, thank you. That makes sense. Yes, Chino.
I feel like having this mental disease is going to affect your life either way. Socially, you're going to be socially things won't work for you because it'll become socially awkward. During your highs, you're okay, and then during your lows, it's really horrible. So socially, there's no balance. Um, as people, we need to have a social balance. So there is a social imbalance that takes place in the workplace. Well, your performance is not balanced. So basically, what I'm trying to say is, the bipolar disorder um, affects the social balance. Your relationships are not socially balanced, and basically everything is just not balanced. That's all I have to say.
Oh, can I please add?
Yes, go ahead, ma'am.
Yeah, so from Bianca's point, she reminded me of something fascinating about people with bipolar. I always say to people, I think it's one mental disorder that I know that has got a bit of an advantage. When a person is in the manic phase, sometimes they are able to think outside the box, and sometimes they're able to get these amazing ideas. So this is why you find that we've got a lot of celebrities, a lot of big people, a lot of big businessmen who have this diagnosis. And I actually think there's a perfume called Mania. Yeah. So that's the positive side.
That's something interesting. I didn't know.
Yeah.
So I have a question. Can I ask a question?
Go ahead.
How does someone know it's bipolar disorder? Because they may think when they're on their high, that's their personality, that's who they are. And then when they're on their low, they could just think it's depression, but it's not bipolar.
So when you have bipolar, you're not really in control of yourself. If you're not in control, then you're more likely to have bipolar. If it's your personality, then you'll be able to control some things.
Okay.
Yeah. Like I said, with bipolar, you suddenly feel happy, you suddenly feel energetic, you suddenly feel like there's no need to sleep. You know, you want to study all night, or you want to clean your house all night. Yeah.
So, advice for anyone diagnosed with bipolar disorder, how would you advise them? What would you tell them to do and what not to do? Therapy, that sort of thing.
Yeah, so bipolar, two main things. You see a psychiatrist, so the psychiatrist can prescribe some medication to stabilize the mood. 2, see a clinical psychologist to help you with psychoeducation and to help you handle situations like, say, at work or at home, and being able to tell when you're about to have an episode before it blows out of proportion.
I have a question.
So, if you guys have any questions you'd want to throw to our psychologist, Bianca and Tino, I think this would be the time.
I have a question. So how are you able to is it possible to have a diagnostic test on your, if you want to check if you're bipolar? Because sometimes you can have episodes, episodes in quotes. So can you test yourself, or you need to go to a mental health institution or something?
Yeah, so that's a good question. So the best way is to go and see a mental health professional. Go and see a psychiatrist or go and see a clinical psychologist, because there are tools for assessment, and you need someone who's skilled and someone who knows what they're doing. You remember Anopa's question when he said schizophrenia and bipolar, is it one and the same thing? So it's easy sometimes to for a person to diagnose you with the wrong condition. So go and see a professional. That would be my advice.
Okay, thank you. Bianca, would you have a question for ma'am?
Yes, I do. So, like we were talking about earlier, in our society, in our Zimbabwean society, every mental disorder, people just say anopenga or akaroyo or something like that. How do we bring about conversations of mental disorders and sort of differentiate them in our societies?
Yeah, so that's a good question. Maybe you've got a few answers as well yourself. So maybe mental health awareness campaigns, they might help. You know, someone said to me when they found out that I work in a psychiatric hospital, they said, you know, you need to pray a lot, there are spirits there. So there's this thing, whether you're talking to a traditional healer or you're talking to a pastor, there's a belief that this thing has got lots of spirits, but they wouldn't say the same about HIV, they wouldn't say the same about diabetes. So I think bringing in the traditional healers, bringing in our pastors and having conversations around mental health would go a long way, so that we can all work together.
All right. Thank you, ma'am, for that. Thank you, Bianca, for your question. So I just thought, for interest's sake,
Yeah.
some facts I came across about bipolar disorder. If you noticed how I structured my questions for this discussion, they were sort of centered on these facts. And then if you're interested, you can check out the site www.mindurgentcare.com. They really help when it comes to you understanding mental health issues. So I think for this week, this is it. On behalf of Create Zim, thank you for this discussion. It wasn't what I intended, because some of my friends, I think they pulled out last minute, and yeah, I was expecting a bigger turnabout, especially for my first meeting when I'm the one who's the only facilitator. I thought, yeah, it's going to really get. But yeah,
Yeah, it happens.
it happens. So thank you guys. Thank you so much.
It's a pleasure.
Thanks for leading the meeting.
You're welcome.
Whew. So yeah, the meeting is done. That was something. I hope you guys enjoyed this week's meeting. I feel like I may have messed up some way. There's a mistake I'm suspecting I made with my secret. I hope it's not what it looks like. But yeah, so this was this week's meeting. So 10 October is Mental Health Day. I hope you guys are also counting down to that. And I'm really, really looking forward to that. And I'm hoping that one of our Zoom meetings are going to be really, really big on that Mental Health Day. I hope you guys have that. So yeah, thank you for tuning in. See you guys next week.